Deafblindness is a combined loss of hearing and vision that significantly impacts a person's ability to communicate, access information, and navigate their environment. The degree of hearing and vision loss can vary widely from person to person, and deafblindness can range from mild to profound impairment. It's a complex condition that requires specialized support for individuals to manage daily activities and communicate effectively. Types of deafblindness. Deafblindness can be categorized based on when the hearing and vision loss occurs and the cause. Congenital deafblindness refers to individuals who are born with both hearing and vision impairments or who lose their hearing and sight at a very young age. Causes may include genetic conditions such as CHARGE syndrome, infections during pregnancy, such as rubella or cytomegalovirus, premature birth, which can increase the risk of sensory impairments. Acquired deafblindness occurs when a person loses both hearing and vision later in life due to various factors, such as age-related degeneration. Loss of hearing and vision can occur due to conditions like presbycusis, age-related hearing loss, and macular degeneration, vision loss. Illness or injury. Traumatic events or illnesses such as meningitis or a stroke can cause deafblindness. Usher syndrome, a genetic disorder that causes both hearing loss and progressive vision loss due to retinitis pigmentosa. Progressive deafblindness. This type involves gradual loss of both senses over time. Individuals may be born with normal hearing and vision but experience progressive deterioration, as seen in conditions like Usher syndrome. Causes of deafblindness. Genetic conditions. Conditions like Usher syndrome or CHARGE syndrome are common genetic causes of deafblindness. Infections. Certain infections during pregnancy, such as rubella, can affect the developing fetus and lead to congenital deafblindness. Age-related changes. Hearing and vision loss are common in older adults due to conditions like cataracts, glaucoma, or presbycusis. Injury or trauma. Accidents that cause head or eye injuries can result in hearing and vision loss. Chronic illnesses. Diseases like diabetes can lead to vision problems, diabetic retinopathy, and hearing loss. Symptoms of deafblindness. The symptoms of deafblindness vary depending on the severity of both sensory losses. Some individuals may retain partial hearing or vision, while others may have a complete loss of both senses. Common symptoms include difficulty hearing conversations or responding to sounds, problems seeing in low light or recognizing people or objects, balance issues due to loss of both hearing and sight, difficulty communicating, especially in crowded or noisy environments, social isolation and withdrawal due to challenges in communication and mobility. Diagnosis of deafblindness. Diagnosis typically involves assessments of both hearing and vision. Hearing tests. Audiometry measures the ability to hear different pitches and volumes. Photoacoustic emissions (OAS) or auditory brain stem response (ABR) tests are used for infants and young children. Vision tests. Eye exams, including tests for visual acuity and visual field, help determine the extent of vision loss. Retinal imaging may be performed to assess conditions like retinitis pigmentosa. Genetic testing. For conditions like Usher syndrome or CHARGE syndrome, Genetic testing can confirm the diagnosis and help in planning for future care. Functional assessments. Professionals may also assess how the combined sensory loss affects a person's daily life, communication, and mobility. Communication in deaf-blind individuals. Communication is one of the most significant challenges for individuals with deaf-blindness. However, several methods and technologies have been developed to facilitate communication. Tactile sign language. In this method, the person places their hands on the signer's hands to feel the movements of sign language. This is often used by individuals who are both deaf and blind from a young age. Braille. The tactile writing system used by people with vision impairments. It can also be adapted for individuals who are deaf-blind. Pro-tactile communication. A relatively new approach that uses touch cues on the body to provide contextual information along with tactile sign language. Print on palm. The communicator writes letters on the deaf-blind person's palm, enabling them to read through touch. Assistive devices. Hearing aids or cochlear implants can help improve residual hearing. Screen readers, refreshable braille displays, and vibrating alert systems can assist with communication and daily activities. Interveners. Specially trained professionals known as interveners or support service providers help deaf-blind individuals communicate and navigate their environment. Treatment and support for deaf-blindness. While there is no cure for congenital or acquired deaf-blindness, a range of treatments, therapies, and support services are available to help individuals live as independently as possible. Rehabilitation services. Orientation and mobility training teaches individuals how to navigate their environment safely, often with the help of a guide dog or white cane. Occupational therapy helps improve daily living skills. Assistive technology. Tactile or vibrating communication devices, braille note takers, and speech-generating devices can help individuals with deaf-blindness access information and communicate more easily. Specialized education. Children with deaf-blindness require tailored educational programs, often with the help of specialized teachers and communication aids like braille and tactile sign language. Support networks. Connecting with organizations and support groups can provide emotional support, advocacy, and resources for individuals and families dealing with deaf-blindness. Challenges faced by deaf-blind individuals. Communication barriers. Many deaf-blind individuals face challenges communicating with others, which can lead to isolation and frustration. Mobility. Without adequate support, navigating the physical environment can be extremely difficult and dangerous. Social isolation. The combination of hearing and vision loss can lead to feelings of isolation, loneliness, and mental health issues such as depression and anxiety. Access to services. Many individuals with deaf-blindness face difficulty accessing health services, employment opportunities, and educational programs due to the lack of understanding and accommodations. Conclusion. Deaf-blindness is a complex condition requiring specialized care, communication methods, and assisted technologies. With the right support, including rehabilitation, assistive devices, and communication aids, individuals with deaf-blindness can lead fulfilling lives and engage with their environment and community. Early intervention, proper diagnosis, and continuous support are key to helping deaf-blind individuals maintain their independence and quality of life.